Hey everybody, just wanted to give a quick briefing on a couple things, some data, and then a couple items that have popped up. Appreciate you tuning in quickly on a Friday. Um, Unfortunately, we lost more members of the community over the last 24 hours. We lost 4 residents in the hospital and 1 resident in a nursing home, so we lost 5 neighbors. Again, once we get to the point like this in the pandemic, these folks aren't strangers to many of us, and um, unfortunately for our team, again, uh, one of these individuals that we lost was not a stranger to us. So we lost a male, 86, and female, 76, 71, and 61 years of age. Again, want to think about their families and keep them in our thoughts and prayers. Um, Looking at cases, uh, it's tough to get excited on a day you lose people in the community, but we had a good day with cases here. Uh, Thursday, Friday, Saturdays are always our high case days. It's when the majority of the tests come back in from all the different labs that do testing. Yesterday, we had a great case day, down about 150 from the day before last week. Today, we have 240 cases. Last week, it was in the 370s, I believe, on Friday. Uh, just a great sign for cases. Positive rate at 4, 7-day average 5.2. So we are turning a corner here, and we really just need to keep doing what we've been doing, avoiding these gatherings. When we're sick with any symptoms, get a test, stay home. That by doing those two things, we'll continue to get things better. Hospital numbers, good shape, 179, so down a little bit. And ICU, we have 37 of our neighbors in the ICU, so please keep them in your thoughts and prayers. We have 6 neighbors in the hospital that are going to be transferred to our COVID transitional facility with Loretto. So that really makes the hospital number about 173 once we get that through. Those are COVID hospital numbers. Those are residents in our county who have COVID. We track all hospital capacity, and our number, since we've been tracking since October, is the best it's been overall. So it's down to 1127 with our 3 major hospitals. Normally we have about 1,700 beds. With the governor ramping up the beds, it's really 2,100. 1127, this is the best we've been since we've been tracking. So really want to thank all of our hospital partners and the great work they've been doing and their staff, as this is all about hospital capacity. It's all about treating our sick and vaccinating. So that's there. With the vaccine, we had a clinic yesterday. Essentially, we have no more vaccine for the week. We'll get alerted Sunday or Monday as to what we will have next week. We will have new appointments next week. We understand that it's tough for seniors to participate in a quick registration process. My team's working on a plan for seniors. We'll talk about that on Monday. Trying to find an equitable way to make sure that seniors have a fair shot at the new slots that come in the community. The challenge being each week we have thousands of people getting vaccinated, but 2 of our sites that are getting large supplies of vaccine, those appointments are already scheduled. So the reality is the only new appointments are the ones that we get each week in the county. So the competition for those appointments is really incredible. So we're working on something to bring equity for our seniors. We'll come out with that on Monday. Nobody's going to get left behind, period, in this process. We have developed an infrastructure to be able to vaccinate and vaccinate quickly, large numbers. This is our mission in county government. We just need the supply. So once the supply comes, we're going to do this. We're going to do it quick. And then once we get through this backlog, we're going to go micro-target into communities to make sure that everybody who wants a shot gets a shot. Some positive news to end the day, I believe. One of the things we've been doing and doing well with our testing is we've been testing in schools. We want to make sure schools are safe for our young people and our teachers and our faculty. We've been doing testing in the month of January, tracking that data. The data showed something very clearly, that the regulations in schools are working. Those who are sick with symptoms of COVID aren't getting in the buildings because of the regulations. And then we're doing asymptomatic testing in the buildings, right? So that process has worked well. Our asymptomatic testing, we've done 10,000 tests in the month of January in schools, and the positivity rate, 0.25 during that period of time. Again, 0.25. So we've been pushing to let our kids have an opportunity with our winter sports, let them play. We know we can figure out a way to do this safely. College sports and these same sports are figuring out ways to do this safely. Today, our advocacy worked. The state of New York is allowing on February 1st these high-risk winter sports to begin at the discretion of the local county health departments. So we will work with Section 3 and all the superintendents and athletic directors on protocols, on safety protocols over the next few weeks here, and we're going to have a season this year. So for all of our student athletes and their families, I'm happy for you. We're gonna show we can do this and do this safely. So we'll work with the Section 3 officials, the superintendents, and the athletic directors next week on protocols for this. Saying that, please, we're making so much progress. Let's be smart this weekend. Avoid large gatherings. Any symptoms, get a test. We got weekend testing at Essential Health. We have weekend testing for asymptomatic individuals at the On Center. And let's enjoy the Syracuse athletics this weekend, big games. Buffalo Bills got a big game this weekend, as do my Green Bay Packers. So let's continue the hunt for a Packers-Bills Super Bowl. Stay safe.